A 9 News undercover investigation can reveal more than 100 electricians employed by Queensland Health have been paid to not work for months. Despite staff wanting to go back on the tools, the government is instead paying other contractors to come in and do the jobs instead.
If you need an electrician and can't get one, it might be because they're here, being paid to work at Queensland hospitals as contractors, even though Queensland Health's own staff electricians are also on site, being paid to do virtually nothing, spending a lot of their time in the staff room.
They have to come to work, but I don't know what they're doing.
Queensland Health electricians say they want to work, but aren't allowed to do any electrical jobs.
There's still plenty of work to do around the place. The pile of work that's mounting up is just crazy.
Between 100 to 130 electricians in Queensland hospitals were forced to down their tools in July, restricted to little more than changing light bulbs, while in the meantime the government pays private contractors to come in and do electrical work, with taxpayers forking out for all of it.
It costs a lot more than if we were working.
So why aren't Queensland Health electricians doing any electrical work? It all comes down to red tape. In Queensland, any company which employs electricians to do work for a third party needs an electrical contractor licence. In this instance, the electricians are employed by Queensland Health and are doing work for Queensland Health hospitals. But because the hospitals are controlled by hospital boards, the government has legal advice an electrical contractor licence is required, and Queensland Health doesn't have one.
How long's that been going for now?
A little while.
2 months?
Yeah, easy.
Doesn't sound like they're moving quickly.
Well, government doesn't move quickly. I don't know if you ever dealt with government, but they're slow to wet weed.
Queensland Health won't say how much it has spent on contractors. An estimate of the wages bill paid to the electricians not working is around $1.5 million.
This is alarming because right now we need tradies to work on the housing crisis. The last thing we need is for them to be bogged down in hospitals.